to be tapping very lightly on the back. Just let me know if you feel any pain. I'm just going to check. This might help us reduce irritation. Okay, Chloe, I'm going to be taking a look at your back. We mentioned that you've been having a bit of pain. So I'm just going to be taking a look at how it's aligned. Put on some gloves. Start just taking a general look. Notice a few little breakouts. The back to localize on this area. I think they're mostly located where the bra would usually go. And if it's too tight, it might be causing some irritation. Just something for you to consider. Taking a look, palpating very gently, looking for anything that might be inflamed. Or just any hard lumps. So we're just going slowly. Looking for any changes of temperature. Sometimes if there's an injury, the area can be hot to the touch. Okay, so far everything feels normal. I'm going to be taking a few measurements here. be tracing the vertebrae. We're just starting at the base of the neck. I'll be making a few marks just to help me detect any deviations. Go very slowly. I'm not marking all the vertebrae, I'm just marking a few for reference as we notice any deviations or changes in the curvature. Take a look here. Be feeling for that shoulder prominence. See. Now we're looking for the top of the scapula. Okay, very good. Okay, so there's a little deviation right at the center of the back. I'm also be using this device to test for any inflammation. Yeah, we can see how there's a bit increased fluid in this area, which is consistent with the pain that you have been feeling. I'm going to be tapping very lightly on the back. Just let me know if you feel any pain. So now I'm just comparing both sides to determine if there's a side that's more affected. It does seem to be symmetrical along the spine, so both sides seem to be affected right about this. Okay, Chloe, I'm going to be asking you a few different questions. First, I'm going to be using these brushes. They're exactly the same, but let me know if you feel the same sensation on both sides of your back, or one feels rougher or smoother or harder. Okay.
That's rough.
Rough, and they're the same on both sides of your spine?
Yeah.
Okay.
Both rough.
Okay.
Soft and rough.
Okay. Where did you feel rough, on the right or your left side?
On my right.
Okay. Let's do one more.
Soft.
Both of them? Yeah.
Both rough.
Okay. I'm going to be using two different objects. One is going to feel sharp. Do you feel that? And then this one should feel dull. Do you feel the difference? Okay. So just Go ahead and tell me if you feel sharp or dull.
Sharp. Sharp. Dull.
Okay.
Dull. Dull. Sharp. 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 Dull. Sharp. Sharp.
Okay. So we have an area right here where sensibility seems to be compromised. Okay. Now we're going to use a couple different sensations. One's going to feel wet. Did that feel wet to you? No. How about now? Does that feel wet? Okay. Does this feel dry?
Kind of. Dry.
Dry. Okay. Let's go ahead and try. If you get some wrong, it'll just give us some information, so don't be afraid.
Wet. Dry. Dry. Wet. Wet. Dry. Wet. 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 Dry. Wet. Wet.
So again, we see some areas along the upper back where it's a little bit harder for you to distinguish. I'm just going to check. I'm just going to very gently scrape. I'm just looking for any small lumps or masses that I might have missed. Be very, very thorough. Should be okay. To check if there's any reflux. Now can you go ahead and tell me if you feel some air on your back? Okay, go ahead and tell me if you feel one. Is that 1, 2, or 3? Okay.
1, 2, 1, 3, 1, 2, 1, 3, 1, 3.
Okay. Now go ahead and tell me if these feels warm or cold.
Warm, cold, 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 warm, warm, cold, cold, warm.
Okay. So I think this gives me a really good idea of what's going on in your back. We're going to do a few different things and try to release that misalignment. I'm going to start with some vibration therapy. You're just going to feel some vibration along your spine. If at any point you don't feel the vibration, let me know. Okay. This might feel a little bit cold. Just try to very gently release any tension away from the spine. We're not really touching the vertebrae, we're just going alongside and moving to the lateral areas of your back. be using this electric washer. It's gonna start warming up. So I'll let it start warming up while I add first the cleansing foam. This might help us reduce irritation. It's just a first good step to sanitize before we start the treatment. Now we're going to add oil. I'm going to start. If this gets too hot, let me know. We're going to be warming up the muscles first. And we're going to be focusing on the area that was affected. The middle, upper back, right alongside the spine. Warm up to avoid any injuries. Here I'm going to be using this wooden tool. Serves the same function as a washer. I'm going to be using this cupping tool. We will be doing some sliding cupping. So this is a little bit more gentle than the regular cupping technique. It won't leave any marks, but still gives us some benefits similar to cupping. Come this space right along the scapula. Just going to massage that. You want to drain any fluid that gets trapped in the muscles. I'm going to be doing a little bit of Swiss cupping. Now I'm going to be pulling very gently on the skin. You might feel like a little pinch. Just gently removing some of the excess oil. If at any point you feel pain, let me know. You shouldn't really feel painful, just a pinch. This area even feels a little bit looser. That's great. Now we're going to be doing some very light adjustments. Just trying to realign the spine. Okay, Chloe, I do recommend that you take an ibuprofen when you get home. You might feel a little bit sore for the next couple of days, but it will go away and then you should be feeling a lot better overall, okay? If you have any questions as you start healing, please give me a call. I'm always here for